what I'd like to help delineate. So in 2011, we published a series up in Boston in the European Journal of Cardiothoracic Surgery describing all patients who survived at least 3 years after surgery or after extrapleural pneumonectomy for mesothelioma. I actually called this long-term survival, and the reviewers panned it. They didn't think that 3 years was long-term. For mesothelioma, I would argue it is, but there you are. So we looked at all patients who survived at least 3 years to see how they differed from those who didn't in terms of clinical demographic factors. The idea is to figure out who we should operate on. So all patients who had extrapleural pneumonectomy between 1988 and 2007 and looked at their complete preoperative data, including labs, and that will be relevant in a minute. The reason we chose extrapleural pneumonectomy only is for that reason I showed you that picture of the specimen. The most complete staging is obtained from an extrapleural pneumonectomy specimen. So you know you're comparing apples to apples, oranges to oranges, if you're looking at those specimens. For the patients who survived at least 3 years, we looked more closely at their perioperative morbidity, staging, and survival. And the groups differed on many fronts. I'm going to call them long-term survivors because the reviewers aren't in this audience, I don't think. The long-term survivors were younger, were more likely to be women, more commonly had epithelial disease, as we would expect based on what I told you earlier, and more commonly had normal labs preoperatively. The purpose of this slide is just to show you that the long-term survivors included patients with advanced stage disease. Staging in mesothelioma is, not surprisingly, also controversial. There are multiple staging systems. There's one that has been abandoned, the Bouchard system we rarely use. There was a Brigham system in 1999 and a later revised system. There's, of course, the AJCC TNM or IMIG staging system. No matter what staging system you used, you can see that there were some advanced stage disease patients who had surgery and went on to live. Looking at the morbidity, I can tell you, having taken care of these patients for at least half a decade now, these are all the usual suspects in terms of postoperative complications and the usual rates. The concept being that postoperative morbidity